look for severe chest indrawing.
Chest indrawing occurs when the effort required to breathe in is much greater than normal. The lower chest wall goes in when the child breathes in. Chest indrawing is only significant if it is present all the time and definitely visible. This child is breastfeeding. If you see chest indrawing only when a child is upset or trying to feed, but not when resting peacefully, do not call it chest indrawing. This child only has chest indrawing when feeding. Therefore, we would not call it chest indrawing.
Mild chest indrawing is normal in young infants because their chest wall is soft. It is not a sign of illness in young infants. This young infant has mild chest indrawing. However, severe chest indrawing is a sign of illness. Severe indrawing is a very deep movement and is easy to see. This young infant has severe chest indrawing.
Fast breathing and chest indrawing.
You should write down the number of breaths you count and then decide whether or not the child has fast breathing. You will be told when to start and when to stop counting. After 1 minute, this symbol will appear on the screen and there will be a pause. You will have time to write down the result of your count and to decide if the child has fast breathing.
Count the breaths Abdi takes in 1 minute. Find an area of the abdomen to watch. Prepare to start counting. Start counting now. Stop counting. This young infant has grunting. You may hear short, soft sounds as the infant is breathing out. This young infant has grunting.
Look at the umbilicus. Is it red or draining pus? This is a normal umbilicus. It has no redness or pus.
This umbilicus is showing some signs of infection.
Skin pustules are red spots or blisters which contain pus. If there are many pustules or a big boil, this is a serious bacterial infection. This young infant has many skin pustules.
Fever is uncommon in the first 2 months of life. If a young infant has fever, this may mean the young infant has a serious bacterial infection. In addition, fever may be the only sign of a serious bacterial infection.
Young infants can also respond to infection by dropping their body temperature. If you do not have a thermometer, feel the infant's abdomen or underarm to determine if it feels hot or unusually cool.
It is normal for young infants to sleep most of the time. The young infant should wake to noise or if he is moved. There is no difficulty in waking this young infant. He is not lethargic. He stays awake.
If a young infant does not wake up during the assessment, flick the sole 2 to 3 times and look for the response. This young infant wakes up and remains awake. This young infant wakes up momentarily but sleeps again. He has poor response to flicking of the sole and is therefore lethargic.